thank you for being on the programme. Coronavirus, of course, affecting every part of the United Kingdom. Is Scotland prepared?
Yes, we are prepared, and we're preparing all the time. Our preparations have different strands to them. We're working with other nations in the UK to understand the science, to listen to what it is telling us about what we potentially face in the weeks and months to come, and also listening to what the science tells us about the potential actions we can take to try to slow down the spread of the virus, reduce the peak of people who are infected at any one time. But right now, of course, we remain in the containment phase. That means identifying confirmed cases, making sure that everybody they've been in contact with is traced and followed up and given the appropriate advice, trying very much to reduce and prevent the spread from individual to individual. Another strand, of course, extremely important, is making sure our National Health Service is ready to scale up the response that it is able to provide. And all of our NHS boards have very clear escalation plans in place about what they would do if demand from coronavirus is to rise in the weeks ahead. So there is a wealth of preparation underway, looking at how we better support vulnerable people, people who might be asked to self-isolate, who means that they will be in a position of not being paid for the work that they're doing. So it's a serious situation we face, and that's true of all of the governments across the UK, but we're taking it seriously and we're doing everything possible to mitigate it as far as we possibly can.
You were talking there about the potential need for the NHS to scale up. We just heard from the Chancellor, Rishi Sunak, who was saying that the budget could potentially contain measures to help the NHS, more funding perhaps for the NHS if necessary. This, of course, will have a knock-on effect in Scotland. Do you think that more funding will be needed for the health service in Scotland and also across the rest of the UK?
Yes, I think that is pretty much inevitable, that we will need additional resources for our National Health Service, although, of course, we are right now working within the resources that are available to the Health Service. Scotland has just passed its budget for the year ahead, which in itself delivers record funding for the National Health Service. But the pressures that are likely to come from coronavirus in the weeks ahead, it will mean that we need to see additional resources. So I very much hope that the budget has positive things to say about that. We also want to continue to talk to the UK Government about how we do support people in what we describe as the gig economy. I certainly hope that we'll see a relaxation of universal credit rules. We don't want people who are being advised to self-isolate, to minimise the risk of passing the infection on to others, to be sanctioned on their benefits. So there's so much to do. All of the governments across the UK are working very closely and very constructively together, as people have a right to expect. I'll participate tomorrow in the COBRA meeting that the Prime Minister will chair, just as I did last week. The Scottish Government's own Resilience Committee, which is our equivalent of COBRA, has been operational for some time. So there are serious plans being implemented. And, again, we've got to stress, well, two things to the public. One, this is a serious situation, but the vast majority of people who get this virus will have very mild symptoms and recover reasonably quickly. It will be a smaller number of people who perhaps become more seriously ill, and the focus, therefore, is making sure that our NHS is equipped to provide them with the care and the treatment that they need. But the second point is the one that all politicians have been making now consistently for some days. The public have a part to play in helping us to contain and then slow down the spread of the virus by following all of the personal hygiene advice that is there about hand washing, what to do when you cough and sneeze. All of that really matters, and it really makes a difference.
Now, you, of course, have been fully briefed on the outbreak. You've been in the COBRA meetings last week. You'll be in the one tomorrow. The Sunday Times claims this morning that ministers are preparing for a coronavirus death toll in the region of 100,000 people. Is that correct?
Well, look, we're looking at the scientific worst-case scenarios right now, and we've heard other figures in the past number of days that up to 80% of the population could be infected, although the vast majority mildly. So these kind of figures are very much worst-case scenarios. What our focus is now is on working out, with the benefit of the best scientific advice, what measures we can and need to take to reduce that impact as much as possible. When we
is it correct to say?
And it probably is a case of when now. Look, I'm not going to. We're looking at worst-case scenarios, and these kind of figures are broadly in terms of the worst-case scenario figures that we face. But these are not forecasts, and I think this is the important point. Worst-case scenarios, reasonable worst-case scenarios, are not forecasts of what will necessarily happen. And I think from a point of public assurance, it's important to be clear about that, but we are looking at a range of measures that we can take. I was going to say, when we move into the delay phase from the contain phase, and it's probably now a case of when, not if, and that will be done in a phased way, there are a number of options that ministers collectively can take in order to slow down the spread of the virus. Over the next number of weeks, that will be the priority, slowing down the spread so that the number of people infected at any one time is reduced, and that makes it more possible for our National Health Service and wider society to cope. So there are some difficult judgments that governments are going to have to take, but it is important that we do everything we possibly can to mitigate the impact.
Talking about those difficult judgments, Glasgow is hosting the Climate Change Summit in November. Are preparations for that at risk because of coronavirus?
Right now, preparations are continuing, preparations are intensifying, and the work around that between the UK Government and the Scottish Government, Glasgow City Council, the police and a range of other partners are progressing very well, and it's important that that work continues. Right now, there is no suggestion that that will not take place in November of this year, but we are in an evolving situation, and all ministers acting responsibly have to be very clear that everything has to remain under review, because we need to make sure that we are taking the responsibility to limit the impact on the population as much as possible very seriously. So, of course, events that are coming up in the months to come will be under review, but there will be a balance we're all seeking to strike, doing everything we can and everything we need to do, even if it involves difficult decisions, to protect the public as much as possible on the one hand, but of course striving as hard as we can to have business as usual as much as possible as well. So tough judgments, and in a situation like this, it is really important that all of us as politicians resist the temptation to do things for political expediency. Sometimes it's easy to do things that make it look as if politicians are acting, but what we must do is listen to the science, try to understand what that tells us, and take the actions that are going to have the biggest impact on protecting the public as much as possible. It's a big responsibility on all of us, and we all have to seek to rise to that challenge.
Talking about rising to that challenge, you, of course, have been involved in those meetings with the Prime Minister. What do you make of the government's response to coronavirus?
Well, all of the governments are working together across the UK, and I think we are all working as hard as we can and as best we can to make sure we've got the right response. There are a multitude of things that I will no doubt talk to you about in months to come that will be critical of Boris Johnson. I'm sure he will have things that he is critical of me over. That's the nature of politics, but I don't intend to get into a position of criticising the UK Government over this, because I want us to work together. If we have differences of opinion about how to deal with it, and that's not the case at the moment, I should say, then we'll work through these. But it's really important, and I think the public have a right to expect that all of us in a position of responsibility and in a leadership position work together and do the right things to protect the public.